Perioral dermatitis is a condition that has been blowing up on TikTok, with the likes of Alex Earle and Natalie O'Neill experiencing this really tricky skin condition. So in today's video, I want to help you spot the signs of perioral dermatitis and teach you how to treat it. We saw a ton of perioral dermatitis during the pandemic. Mask wearing definitely played a role. However, it has shown no signs of abating ever since. So let's get into what this condition looks like. Perioral dermatitis is a condition that tends to affect females, a bit like melasma, where only 10% of those who experience it are male. And if I'm honest, I can't recall seeing a guy in my clinic for this condition for a few years, actually. As the name suggests, this is a rash that happens around the mouth, perioral. And it has a very typical appearance. So the dermatitis part pertains to the fact that sometimes it looks red and flaky, but when you zone in really closely, you see these little red bumps. They're very tiny and they all look the same. The term that we use is monomorphic. They can look a little bit like acne when they are occurring in discrete areas like the chin, but what is really typical is this distribution. It almost follows the nasolabial crease and spares the skin right next to the edge of the lip, the vermilion border. The skin can be sore and a bit uncomfortable, and the changes can even extend up to around the eyes, where it becomes periorificial. So the eye socket is another orifice, a bit like the nostril in the mouth. And the same appearance of red, tiny bumps, all looking the same, can occur. A bit like rosacea, what distinguishes it from acne is the absence of closed comedones. So you don't see those little flesh-colored bumps that are the hallmark of acne lesions. We don't really know what causes this annoying problem, but I view it as sitting somewhere on the spectrum between acne and rosacea, in that it's an inflammatory disorder. It can often be triggered by skincare, and it isn't uncommon for it to coexist with either condition. I've been treating this condition for a long time, and what is really clear to me is the importance of the skin barrier. I think of a defect in a skin barrier as being one of the earliest events, and it certainly fits with the explanation that a lot of perioral dermatitis is triggered by using skincare that doesn't suit your skin. Individuals who are prone to this will often experience relatively frequent relapses and remissions unless they get to the bottom of exactly what their triggers are. Now, of course, anything that relapses and remits, that means gets better and gets worse without really a pattern, can be very, very frustrating. So the approach I take when I see someone in clinic with this condition, it's usually pretty easy to diagnose, is to do something of a skincare cull. Perhaps the most important thing to establish is whether or not they've been using topical steroids. Topical steroids are often prescribed in the very early stages of perioral dermatitis, when it can look a little bit like seborrheic eczema, which is a condition characterized by red scaly changes in the creases of the nose, often with dandruff and scaling in the eyebrows. So when it's misdiagnosed as seborrheic dermatitis, the topical steroids that are prescribed can often make matters much, much worse. If topical steroids have triggered perioral dermatitis for you, it is important to stop them, but do bear in mind things can get worse before it gets better, so be consistent and stick with it. One other thing to mention, fluorinated toothpaste is sometimes the trigger. That's one of the most common triggers outside of skincare being the culprit. So if you're someone who brushes your teeth in the shower, no judgment, do be aware that the toothpaste on the skin might be the cause of your issues. So what does a skincare cull for perioral dermatitis look like? In essence, we want to use a regime that is supportive of your skin barrier and doesn't clog your pores. That means using things that aren't fragrance. That means using things that don't contain facial oils. That means using a very simple, uncomplicated skincare routine. In essence, things that are kind to your skin barrier will be helpful. One of the cleansers I use in those with hypersensitive skin that find that they are frequently getting recurrence of perioral dermatitis no matter what they cut out, is the Toleriane Dermo Cleanser by La Roche-Posay. Fragrance-free and preservative-free, this tends to be tolerated by almost everyone. If you don't fall into the bucket of someone with hypersensitive skin, then Flawless Cleanser, which is a wash-off gel cleanser that is very kind to your skin barrier, is a good alternative. When it comes to actives to actively help solve the issue, my go-to is azelaic acid. This powerful anti-inflammatory multitasking ingredient really is the mainstay of my clinical practice when it comes to treating people in the clinic with perioral dermatitis. One of the ways it's so influential is by downregulating how flary or prone to inflammation your skin is through an interaction with something called toll-like receptors. It's also how it's helpful in rosacea. My preference is using Finacea, which is 15% azelaic acid gel on prescription, but you could try something like the 10% azelaic acid solution from The Ordinary, which is a simple and uncomplicated over-the-counter way of getting hold of this useful ingredient. Then you're going to want to use a moisturizer that helps you manage your skin's barrier function. Now, we know that when your skin barrier is damaged, it allows things to penetrate that otherwise would be kept out. So getting that function of protecting your skin from what's outside back to normal is critical. When your barrier is breached, it can be really helpful to focus on rebuilding the skin's microbiome, and two good options for that are La Roche-Posay's Toleriane Dermalogo Soothing Cream and also Flawless Moisturizer Intense. Both of these are super soothing, kind of sensitive skin and will help get your barrier function back to baseline. When it comes to sunscreen for those who are prone to perioral dermatitis, one of the best options is mineral sunscreen. So that's sunscreen formulated with either titanium dioxide or zinc oxide, or sometimes both, to truly get good UVA and UVB protection. Mineral sunscreen just tends to be that bit less irritating. It's something that we use in the practice a lot post-procedure, and it's often tinted, which can be quite a nice additional benefit to help tone down that annoying redness. These two boys do love a filming day. It's important to find the sunscreen that you like using. It's really the only way to make it work as part of your everyday skincare regime, but good brands to look for a mineral sunscreen include HelioCare, Color Science, and Flawless Gossamer offers both a tinted and untinted version depending on what works best with your makeup. If you find your skin is just too irritable in the early stages, it's completely reasonable to just park sunscreen for the short term until things get a little better. I'll often give patients the option of doing this just because one less layer is one less bit of hassle when your skin is red, inflamed, and itchy. Of course, if you live in a hot, sunny country, you must practice sun avoidance while you're avoiding using your sunscreen. For a lot of people, that topical approach will be sufficient, but if you're nervous about managing this by yourself, or it hasn't responded, then the best thing is to see your doctor for advice. Oftentimes, I will use oral antibiotics in the form of tetracyclines, which have a powerful anti-inflammatory effect. And what they allow us to do is to basically minimize the amount of product going on the skin. Sometimes there's just simply a cosmetic load issue where putting too many layers of ingredients on your skin is just keeping the whole process going. And part of that is because of this breached skin barrier. Things are getting in that wouldn't normally penetrate when your barrier is intact. So antibiotics can just take the pressure off, and then once things start to improve, the barrier starts to reseal again, and then you might be able to think about adding in active ingredients that in the longer term are going to help keep your skin clear. I tend to prescribe antibiotics for around 6 to 8 weeks, sometimes longer, but that's usually sufficient to get things going in the right direction. And then if you bring in the right topical ingredients with the minimal skincare routine, in the longer term, that's what's going to keep your skin clear. I find it really satisfying treating perioral dermatitis. It's a really easy diagnosis to make in most instances. It responds well to the right treatment. And I think ultimately what's good about it is that in a way it means you really focus on just using what your skin needs. And it helps us move away from this idea of skincare as entertainment, which you'll probably know I'm not a fan of. We want to use the right ingredients in the right strength, in the right combinations to get the best possible complexion. So I hope you found this video helpful. If so, let me know in the comments, and I'll see you again soon. Bye for now.